Well, good evening, everyone. This is Dr. Ellithorpe. I'm here at Tustin Longevity Center in Southern California, Tustin, California. We are a integrative, functional, complementary, alternative, standard trained medical doctors, general medicine, family practice uh, that are comprised of healthcare providers that are interested in trying to do preventive medicine, restorative medicine, treating the causes and lifestyles that are largely the problem with all our chronic medical problems today, and things like natural hormones and certain nutraceutical and intravenous vitamin therapies and detox and chelation for heavy metal removal. So this is what we do here. We work alongside you and your primary care and your specialist, whichever you have, to bring about the best results. We're happy to announce that we also have some new health coaches that are going to be able to take what you and your doctor, healthcare provider, determine at your medical visit and to amplify that on individual visits with a health care coach, and that to get a better success in your maintenance, recovery, or restoration of your health. We usually meet here on Tuesdays, 6 o'clock to 7 p.m. Today's date is October 22nd, 2024. And we invite you to join us at our tlcdoctors.com, doctors.com, and that is where you can get on our website, our newsletter, and then you can type in your question. There's a link there. You'll get notification of these and reminders for these Tuesday night Ask the Doctor Anything questions. And on the link, then you can type in a question. You can also join us here on YouTube and type into the chat a question. So those that are here live with us can type in a question if they have one. If I see them pop up, I will start using the live and address the people who are live with us. So we will begin with our email questions. Again, this is meant for educational purposes. This is to say, how would I, as a standard allopathic trained medical doctor in family practice, general practice, address the questions about their disease or their symptom from a more natural standpoint rather than jumping to intervention with drugs or surgical remedies, things like that. And this is not meant to be personal advice. It's just how I would think and approach these things. If you have concerns medically, please see your own doctor. Again, if this is a help to you, if you like this, you like the ability to try and connect and put in a question and get some off the cuff first impressions on how a functional doctor would treat these things. I, with my 40 plus years of experience, and the other healthcare providers here with their decades as well, we have a great body of experience and connectiveness with the entire healthcare functional movement. And so we like to give these informations to you as a general thing so you can implement them right now and enjoy the benefits of some of these healthy lifestyle suggestions. All right, so please like and subscribe, share this with your family and friends. This helps us with our algorithm. I don't know if I'm being shadow banned. I probably am, but it does help. So please like and subscribe if you would. The first question that I have is from a person by the name of Deborah. I have essential tremor of my head and neck. I'm taking a B complex with B12 from PR Labs. Is there a better form of B that I may take? And is there anything else I may take because magnesium doesn't do well with my digestive system? Open to suggestions. Well, EDTA chelation therapy would be the thing I would add to a robust B vitamin, as well as a rich protein, healthy fat diet low in carbs with exercise. Now, why is that? The nerves themselves are enwrapped in a phospholipid myelin layer. So the phospholipid myelin layer around all the nerves helps insulate and conduct this impulse speedily. And the only way you can repair the myelin sheath on your nerves is to eat healthy phospholipids and healthy fats, which are abundant and voluminous in meat and fish and pork and chicken with the skin on it, and eggs, and uh, all those kind of things. So what we would encourage you to do is make sure that you're getting at least 1 milligram per pound. 1 gram per pound, not milligram, 1 gram per pound. So if you're a 150-pound woman, you would want about 150 grams of protein a day. That would be something like, 50 grams in your breakfast, 50 at lunch, 50 at dinner. And that's a challenge because most women get only 30 to 50 in for the whole day. And as you age, your muscles are going to be receding and being dissolved away. We shrink, we lose our muscle mass. And therefore, if that's happening, your nerves are being eroded away. Many of these foot problems with paresthesias, tingling, the Morton's neuroma, all this irritation to the nerve conduction of the most, traumatized parts of our body are damaged, and they have to get repaired. So you have to have microcirculation to repair and get right to these areas that need those fats and proteins to repair the nerve lining. Plus, you have to exercise to get the balance and the strength training to stimulate growth and repair factors. So if you're sedentary, you're going to have very little repair signaling in your body, and there's a plethora of uh, we can say peptides and uh, signals in the body that you need to repair yourself. Fasting stimulates the production of repair and rebuild stimulation in the body. So doing intermittent fasting uh, or a 24-hour day fasting once a week. Never eating late. Eating late, especially as you get older, shuts off repair because the food stays in our gut as the nerves and signals throughout our gut are also diminishing with age. So the trend for a aging person is to eat breakfasts and lunch and skip dinners, to eat a higher carbohydrate, higher protein and lower carbohydrate diet, be more like a carnivore as you age, and probably to use digestive enzymes, to be drinking water adequately because we're mostly made of water. And that would be 1 ounce per half your weight in pounds. So if you're 150 pounds, you would have 75 ounces of water a day to get good sleep. Now, EDTA chelation helps remove the cations, which are positive toxic metal ions in your body. That would be aluminum and lead and mercury and cadmium and arsenic and uranium and many other toxic heavy metals that are in our polluted environment. So by pulling those out, it will protect the cell membrane and the impulses so that you won't have this very tremulous type, head bobbing, so to say, from these micro damages that occur in the brain matter and the nerves itself. I have many cases with EDTA chelation therapy with taking very good high dose B complex, which is the methylated B complex, all the B vitamins, where you're getting hopefully closer to 50 to 100 milligrams of thiamine, vitamin B1, and along with chelation, along with a healthy diet in protein and fats, along with a heavier protein eaten in the morning and lunch and maybe skipping dinners, doing weight resistance training and exercise plus aerobics, then taking anti-inflammatory enzymes like Vitalzyme or systemic enzymes, Vascuzyme on an empty stomach, 5 of them on an empty stomach once or twice a day to reduce inflammation. Natural hormone replacement therapy is very calming, very good for balance, nerve, and stimulation of growth repair factors. So, all these things put together usually show my patients to have less tingling paresthesias to their feet, and having better balance and less tremors. So there is a thing called tardive dyskinesia. These are side effects to some of the types of drugs given, like compazine for nausea, and then you can get these, twisted kind of contortions, and these contortions of the nerve systems can be medication driven. It's called dyskinesias, and we've been able to really resolve them. So I'm so thankful to God, and of course we work with their neurologists. It's kind of funny, their neurologists never call back as to what we were doing. So that's all right, just as long as the patient gets better with safe, natural things. All right, so hopefully that will help you, Deborah, with some ideas of how I would work for an essential benign head tremor and neck. That would be the beginning. Try and find a good functional doctor that can help you with that. Mana then says, are you familiar with Dr. Brian Ardis? Yes, I am. And his website is the Dr. Ardis Show, TheDrArdisshow.com. If so, what are your thoughts on his claims that nicotine gum and patches can help with arthritis, pain, long COVID symptoms, viral venoms, and variant exposures? He says nicotine alone isn't addictive. It is the pyrazines. Does every cell in the body have nicotinic receptors? Thank you. It appears that way, Mana. And yes, I've talked on this show about nicotine and the protective effect it dramatically showed during the so-called COVID pandemic, where smokers really were the most resilient. Therefore, the research done on nicotine throughout the world showed great protection by putting nicotine patches on the patients. Those who use the over-the-counter nicotine gum did very well. Those who have long COVID symptoms who use over-the-counter nicotine gum, there is a 2 milligram stick of gum and a 4 milligram, I think. But if you use somewhere around 4 to 6 milligrams a day, they typically see great improvement in what is called the long COVID symptoms. So yeah, I'm familiar with it. And yes, the body has nicotinic receptors all over it, on the muscles and on the glands, and parasympathetic and sympathetic areas of your body in particular. So yeah, it's all valid, and there is research behind it. And apparently, if I'm correct, Europe is now banning all tobacco products from sales. It's not just restricting use from public areas, it's actually banning it. And so I'm surprised, because nicotine is such a valuable item, you might say, for protecting the nicotinic receptors from being attached to by certain uh, invading viral, like spike protein products, and indeed venom, a product of snake and other venomous creatures out there. So I don't know why they would ban nicotine all tobacco products, but it's concerning. At least yet here in America, you can get over-the-counter nicotine gum to chew. I think there's patches also over the counter here in a 7 milligram strength, a 14, and a 24. I think the highest you can get is 24 milligrams. The next question is live and it comes from Caroline, and she says, a lot of people I know use Benadryl when they cannot sleep. What is the downside or the side effects? Well, that's covering up a symptom. Again, our whole philosophy here as real doctors, functional doctors, we're trying to find out why they are not sleeping rather than throwing a drug at a symptom to knock you out and overwhelm whatever it is that's keeping you awake. So Benadryl has effects where it receptors are on the body, which acts as an antihistamine. And this antihistamine is a drying factor. One of the side effects is dry up mouth, dry eyes, dry skin, and for some constipation. Uh, and a droggy effect that might last even into the next morning. So, in a pinch, I remember as a very young doctor on active duty back in the 1970s. Yeah, early 80s for sure. We had the mothers give Benadryl, liquid Benadryl, to help the child on these overseas flights if the father was stationed in Germany and the family was moving or visiting that 7 hour, 6 hour flight. They wanted to help the child sleep, so they would give him Benadryl, and that's innocent enough in itself. But a chronic use is not good for the drying effects and the constipating effects of it. So now, what would I do for sleep? I would tell you to set your clock to get up with the sunrise. When you wake up, I would ask you to, after you empty your bladder, to go in your bare feet outside on the wet grass, get yourself grounded or earthed, and be facing the rising sun so that those infrared long waves, you don't have to face it, it'll go through your skull, it'll go through your clothes. But if you were out there 3 minutes or so, you will get a circadian rhythm charge, and you're uh, lining, enveloping every cell membrane surface is going to have this charged electrically structured water, and it will help it. It'll help the function of every cell and your alertness. And then as the sun goes down, you'll be more sensitive to the release of melatonin and other bedtime inducing things if you don't fight it. I know you can turn a TV on, you can open up a laptop with blue light, which will shine in your eyes and destroy some of the natural signals that your body is trying to get you to get into the dark, blue lightless environment, getting dimmer incandescent lights, red lights, so that as the day progresses into the twilight and night, you can maybe put red light glasses on. You could make sure you shut off all your TV screens and stuff like that, and just learn to listen to something instead of looking at something for your evening pleasure. A lot of people listen to their books at night or their Bible, audio Bibles, or lectures at night instead of watching videos. And exercise. Exercise is very critical during the day with weight training and aerobic to get your body used. And those tiny use particles, every time you contract your muscle, there's going to be tiny little micro damages from the use of a muscle contraction called myosins. That's a collective term for the whole new field of what those little peptides are doing throughout your body to stimulate growth and repair. And they build up to a threshold so that at night you get enough of this myosins from the use of your body, along with earthing, along with adequate hydration, along with not eating late at night, not using alcohol at night, and then getting the light controlled in the evening, and just relaxing to some music that's uh, uh, not heavy metal and high pounding like that. You want rhythmic hertz that are in sync with the body. You could look in the YouTube with music that enhances body's um, Hertz cycles for sleep. That's talking about like the sound of a heartbeat, the sound of a voice. These volume Hertz ranges are very sleep inducing. Or you can listen to a nice person read your. For me, it would be listening to a science lecture or the Bible. For me, very rarely do I listen to music, but once in a while I do, with the lights off in my room as I'm going to sleep. So hopefully that helps you, Carolyn. And going on further, Dawn asks, how do I test for malabsorption of fats and minerals? What information does a complete stool analysis give us? Can calprotectin stool tests differentiate between irritable bowel, inflammatory bowel disease and irritable bowel symptoms? If not, what is the best test to determine inflammatory bowel versus IBS? Thank you so much. God bless you. Well, the complete digestive stool analysis I've been using for close to 40 years. I'm so glad now gastroenterologists, the specialists have finally picked this up, and they're starting to finally look and get some financing to look at more and more studies of the stool and these fragments of digestion, inflammatory marker enzymes and stuff that are in the stool. One of them, these fragments from white blood cell activity and other inflammatory cytokines, you might call it, markers like lysozyme, calprotectin. These are in the complete digestive stool analysis. So I strongly recommend you use it. Yes, you can differentiate between irritable bowel symptoms versus inflammatory bowel disease with this test, especially if you do a repeat test. You can see if you've modulated them, and that goes along with symptom improvement. You can get the trends of the bacterial flora that you have. You can get an idea of food digested products, whether there are undigested foods, meats, and stuff. We can look for fat in the stool that is undigested. We can look for the bile contents. There's so many things we can get. So that's how we look for malabsorption of fats. For minerals, I would do a red blood cell mineral analysis. And that's inside the red blood cell because the serum levels really may be somewhat helpful, but what gets into and contained in the red blood cell is what you really want to know. The most accessible cell in your body to sample would be your red blood cell. So we can look in there and see what your mineral content is. So that's a red blood cell mineral analysis, complete digestive stool analysis. And that is what will help you determine IBD, inflammatory bowel disease, versus IBS, irritable bowel syndrome. Rochelle asks, help for chronic constipation over a year. The stool is hard, dry pebbles, difficult to push out. Can pumpkin seeds, or I can see pumpkin seeds and other seeds from meals in her stool, I guess. I'm 50, blood type A positive, weight training, following your protocol, eating protein for breakfast and lunch, juice plus, good, it's wonderful. Hydrating, using the analemma wand, using minerals, digestive and systemic enzymes, probiotics, the SBI Protect, T3, T4, so she must be on some adequate thyroid support, selenium, iodine, and had a negative Cologuard. Chronic constipation. Well, this sounds like I would want a complete digestive stool analysis on Rochelle and maybe a food allergy. She could be eating what she thinks is a healthy food over and over, which is creating a irritation to the bowel that is making the bowel shut down or be, so to say, paralyzed somewhat. I would ask her also if she's been on Ozempic or Wegovy or what's the other one? I can't think of the other name, but those GLP-1 inhibitors for weight loss, because that can create bowel paralysis. But anyway, the only other thing I would say is she needs to look at her thiamine. And she might go through a phase as she takes thiamine, vitamin B1, and uses it at higher doses. We find constipation responds to higher dose B complex, thiamine in particular, vitamin B1, 50, 100 milligrams, 200, 300, 400. I have seen people, and Dr. Derek Lonsdale, Lonsdale, who just died at 100 years old. He was out of Cleveland Clinic. He wrote the book, you might say, on the many benefits, constipation being one of them, as well as diarrhea, by the way, because sometimes the nerves get irritable because you have both sympathetic and parasympathetic uh, nerves innervating your bowel. And if food lectins are irritating the nerves and it sends back signals that are promoting the parasympathetic slowing of the bowel, then we are going to suggest maybe a trial of thiamine at higher doses. That would be how I would treat you if you were a patient of mine. Your doctor and you can look for a good producer of that. Thiamine usually comes as thiamine hydrochloric acid, HCl. And that's an average type, good type. But one of the better ones is benfotiamine, 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 thiamine. I think there's no H in there. Benfotiamine. And you could gradually build it up. There is a paradoxical worsening from 2 weeks to 6 weeks of symptoms. But once you build up that and your nerves start to respond to the higher signal, typically that will be very, very beneficial with constipation such as yours. Because it looks like you're doing the thyroid, it looks like you're taking minerals, hopefully enough. It looks like you're on a healthy diet. It looks like you're good with your water. Maybe getting outside and grounding at sunrise and getting that circadian rhythm synchronized. Um, and hopefully that would be a direction I would go with your doctor and look at it. Slovig writes, what can I do for Cushing's disease caused by daily hydrocortisone pills as a child for 9 years? So I wonder what kind of reason they put you on hydrocortisone pills as a child. It sounds like you had an iatrogenic. Iatrogenic means doctor caused, or the giving of steroids for like chronic asthma, or in certain burn cases, burn victims, or cancer patients who had chemotherapy, they have to be on steroids. So the doctor had to use the steroids to reduce the immune function from overwhelming the patient at that time. Because there are many causes for Cushing's disease. One of the biggest ones is caused by giving steroid pills like prednisone, hydrocortisone, as a treatment for some other disorder. There can be pituitary tumors, there can be adrenal tumors, other endocrine tumors can do this. Anyway, I'd be interested in knowing what that was. But they go on to say, at 18, I weaned myself off of these steroids. So apparently, this person became hydrocortisone pill dependent because of what they did. I don't know. They took the pituitary adenoma out that was secreting too much adrenocortisone, secreting therapy for the cortisone production in the adrenal glands. I don't know. But either way, whatever happened, it put this person into a dependent state for hydrocortisone pills, for which this person weaned themselves off at 18 when they were an adult and haven't taken any since January 23. This person states, I lost 70 pounds because one of the features of suspecting hydrocortisone stimulated disease is from getting fat as a child, central obesity, like an apple, having little thin legs and little thin arms, but having this central fatness. You start seeing that in a child, you got to think adrenal gland. The other thing, the child doesn't grow tall. The child tends to stop growing in height. So the pediatrician has to think, what do I need to do? An MRI of the brain, look at the pituitary, look at the adrenals, things like that. And a lot of cortisol from these tumors makes them fat. And so when she stopped it, she lost 70 pounds. So I'm so happy for you, Slavik. I still have skinny legs. So this person says they did have the skinny legs, arms, and thick lard type fat around my abdomen, fat and liver, round face, a fat lump on the back of my neck, intestinal issues, but now I have low morning cortisol. What can I do? Well, you have to see your endocrinologist, your doctor, your functional doctor, and get into a restorative program for muscle building, exercise. You're still young. You still have many years ahead to rebuild yourself. And so be encouraged with that. So you'll have to get physical therapy, get a program for weight resistance to stimulate the growth of those muscles to help create the bulk, which means you'll have to eat a higher protein diet. Find out your blood type. If you're an A-type blood, because Cushing's, in my experience, and everything I've done here for 40 years, always happens in the blood type A person first. So you would have to help yourself digest it with digestive enzymes. Plus, the anti-inflammatory effect of systemic enzymes could be taken in place of the anti-inflammatory aspects of steroids. That might help you. Look at your dihydroepiandrosterone, DHEA levels. Start with that. That will never give you Cushingoid symptoms, and that will help you with your levels of adrenals. And have your doctor, your endocrinologist, look into that. Find a good functional doctor. Make sure you're making, depending on, I don't know what sex you are, with the name of Solveig, Solveig. I can't tell if you're male or female. So you need your sex hormones checked. And if you're a female, you have to address your menstrual cycle and the ovulation with that. So all these things need to be looked at. Rich protein diet, digestive enzymes, especially if you're a blood type A, an aggressive, faithful, used physical therapy, resistance training program, a rule about not eating late at night, staying away from all processed foods, and being well hydrated, and certain supportive nutrients, a good multimineral, a good methylated B complex. Iodine would be very important, 12.5 milligrams at least every day. Those are the areas that I would go for, Slavik. Andrea says, can someone take digestive enzymes if they have stomach acid or duodenal, if they have stomach and or duodenal ulcers? And the answer is yes. Yes, they can, because you're going to be making your stomach acid and enzymes anyway every time you eat. You have to use the organ. So what you have to do is be cautious that you're eating a rich, balanced protein, fat diet, and that will help put in the repair to fill that ulcer crater with phospholipids that will heal it more quickly. Not eat late and be low carb, exercise, and stimulate repair. So if you do intermittent fasting, say eat between breakfast and 2 in the afternoon, then your empty stomach is until you eat at 8 in the morning again. That's 16, 18 hours of fasting every day, and that stimulates growth and repair. That's the direction I would go. But yes, you can use digestive enzymes during that time as long as you've eaten food. Okay. You don't want to take a digestive enzyme on an empty stomach. Okay. So I would take it in between my bites of food. And I would use a trusted product. The only one I trust is Orthomolecular uh, Digeszyme by Orthomolecular, because I trust the contents to have in them what they say. I've been using them for 40 years. All right. Debbie says, "Hi, Dr. Rita. What causes infant eczema and what is the best treatment?" Thank you, sister. Infant eczema, there's many causes, but the most common causes our society has made us eat all this processed, high calorie, nutritionally deficient food, which is processed food, which is full of hydrogenated fats. And that is not what our cell membranes are made of. Our cell membranes are made of cholesterol from butter, and mother's milk is full of cholesterol, breast milk, and then the linoleic and alpha linoleic acid. These are things that they demonize. They want you to think you're a fish, and you have to take 5 and 6 double bond chained fatty acids, which oxidize so quickly. It's ridiculous to think you can get them in capsule form and they're not already having a rancidity problem by the time it gets to your jar, your store, and the time it goes down your throat. So we feel that eating a healthy diet is the best thing you can do. I have the clinician's preference oils. These are the alpha linoleic and linoleic with the 2 and 3 double bonds, which are far, 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 far more stable. And it's in liquid form. You could give the baby a little half teaspoon of this once a day, because the cell membranes in the baby, if they're not made well, because mother wasn't eating quite as well and didn't know she wasn't getting the healthy fats to make a healthy cell membrane, then when the baby's born, these weaker cell membranes are more triggered and injured by the environmental irritants, maybe the soaps and laundry detergents, animal hair, pollens, chemicals in the environment touching their skin, maybe the bath bubbles, all this kind of stuff. So I would uh, say the number one cause I've always seen improve it is uh, breastfeed as long as you possibly can the child. If the child's not breastfeeding or partially breastfeeding and with table food, then I would put as much as you could of pureed, healthy grass-fed chicken or fish or beef, and put in some of that clinician's preference oils. I could even topically use the oil and rub it on the cradle cap or their skin and let them go to sleep. And remember, a baby's skin will grow very quickly out from the inner dermis to the outer dermis. And you'll see within a week or two great improvement. Um, and certainly at the end of a month, you'll see great improvement. And it should be all cleared up in 2 months. For an adult, it's going to take 4 months. So anything you do to see your hair grow, your skin look better, and you do all these same things, then you're going to have to wait 4 months for the whole new layer of skin to show up. Do I have any new ones? Yes, we have some new ones here. Carolyn says, "My 32-year-old daughter has a hard time digesting meat. She gained weight, but it's in her stomach and hips. I got her the digestive enzymes you suggested, and you said it's helping. Hang in there, Carolyn. Just give it time. Anything worthwhile, brick by brick, precept by precept, we build the right things into our life. She feels better, and the bloating and gas has gone down. Well, praise the Lord with orthodigestive enzyme. Now, we private labeled this. Orthomolecular allowed me to make my own private label. Orthodigestive enzymes are what these are. It's the exact same thing. But hopefully we get a little better price and can help our patients. Rosa says, hello, doctor. Does grounding only happen at sunrise? No, it happens all throughout the day. But one of the most amplified times is in the morning for all kinds of quantum physics, astrophysical, geometric phenomena. Um, and getting the dew in the morning, you have that wetness on the earth's surface, and that is a great conductor to help the negative ions to go up into your body and help electrochemically kind of calm all your cells down. And you have to do that any time of the day that you're in grass, or your hands or feet are in the dirt, or you're in the sand at the seashore. It will work all the time, but it is most notable, and the long wave infrared waves of the morning sun are probably the most noteworthy, because during the day, then it gets, it's always there. In infrared is always there throughout the whole day cycle. But then you get the blue and the other lights, UVB, UVA, UVC, and we want to try and avoid those. Okay. Let's see. Can it be done when I wake up? Yes, absolutely. That's what I do. First thing when I wake up, after I, uh, empty my bladder, and I typically will read my Bible and take my water and get a cup of coffee ready. I will go outside after my Bible reading to kind of ponder what I've read, and then my feet in the wet grass outside in the morning rising sun for about 3 minutes. Yeah. Uh, Philip says, what time do you recommend to stop eating at night for older person? I would say the latest I would eat is 5 o'clock in the afternoon. Preferably, I would say 3 o'clock, because honestly, food stays in your stomach for hours and hours and hours longer the older you get. So consider using digestive enzyme, even if you're not a blood type A. If you're over, 55, 60 years old, I would give it a try to help you with your digestive health, move the food through, and get an empty stomach, so that when you lay down at night, you can heal more, means you'll live longer. Okay, back to the questions here. Uh, Christina, do certain clothes materials affect our endocrine system, like polyester or rayon? The answer is absolutely yes. These plastics, God only knows where they came from, that they distilled them down, and what kind of chlorine rinses and bleaching they put the plastics through before they turned them into fine threads. And this is a known source of microplastic contamination and endocrine disruption. Now, uh, there many states require infants to wear fire-resistant treatment of their clothes, and those chemicals have been found to be endocrine disruptors in the little gentle, infant, baby, toddler clothes. It's crazy. So I would try and stay away from it. I would stick with pure linens, linen sheets, anything you can do like that to get away from these synthetics as much as you can. Very often, your sports clothes, like your bra, the elastic lining around the waistband on your underwear, in your socks that give them that elasticity. All these things are indeed filled with this plastic, synthetic, chemical, endocrine disrupting materials. Stay away from it. Uh, Krista says, hi, I am really learning a lot and was wondering how to purchase from your online store. Thank you. Krista, I would call, because I am, in my 70s. I'm not your best internet communication person. Call the office, 714-544-1521. 714-544-1521, and then ask for the vitamin department, and the wonderful people there, Kelly and Alex, and my husband John is often there, and they can help you with learning how to access these proven, tried and true nutraceuticals that we test clinically decade after decade on their continued performance in our patients. So yeah, they'll help you with that, Krista. Thank you so much, because that certainly helps us. We are definitely needing your support that way to stay alive and be here to serve you. Lee says, what supplements do you recommend for someone in perimenopause to take to have optimal health? What about postmenopause? Lee, this is a process, and there isn't some miracle. Let's make a vitamin for premenopause. Let's make a vitamin for perimenopause. Then let's make us a vitamin for postmenopause. That's just really just being simplistic and just marketing. It hasn't anything to do much with science. What people need is a well-informed healthcare provider, functional doctor that you might call them, someone familiar with, uh, far more familiar with nutrition, physiology, hormones, all this kind of stuff, than their board certification for their narrow, little tiny area of academic knowledge and skills. If you find such a functional doctor, then they're going to meet you, find your age, your where you are in your cycle. Are you starting to skip? Are you starting to hot flash? They'll sample your hormones. They'll teach you that the time that you're in the near to menopausal can be uh, variable. 1 month you could make plenteous hormones and feel normal. The next month, you may not make so much hormones, and you will crash and get an irregular menstrual flow and cycle, maybe fatigue, irritable mood, because hormones affect every part from our thinking, our sleeping, our sense of well being, our emotions. So you have to have a doctor who has this kind of understanding. And then the physiology of the cell and the need for the nutrients are basic core elements that every human needs, all blood types need, with little nuances that only a visit with a healthcare provider, like your blood type, your age, your body composition, how well you hydrate. Are you on night shifts working? Are you a mother with still children at night that keep you up? All these things, plus many others, need to go into it. Looking at your vitamin D level, looking at your uh, bowel movement regularity, looking at the strength and well being of your sleep cycle. Uh, all this must be looked at. Your iodine level, your enzymes are a huge part of the anti inflammatory effect of menopause. And then to even introduce to you the value of some natural hormones. I put all my perimenopausal girls, and many times I even use premenopausal girls, with progesterone, because stress, emotional stress, worry, fear, that cortisol impact will shut off ovulation. And if you don't ovulate, you're going to get estrogen dominance, which creates symptomology too. So until they start teaching doctors how to really be doctors instead of narrow pinhead micro specialists of a tiny part of your body, and get overpaid for that, until you find a real doctor who can handle all these things, then uh, I recommend that you ask specific questions, and we um, can give you general responses about how I approach uh, a certain age group, a certain sequencing of menstrual cycles, and your body composition. But we can't practice medicine over the internet. Find a good functional doctor. You could go to acam.org. Usually, the American Academy for the Advancement of Medicine, acam.org, has doctors who are attempting to go back to the study books, go back to the grind, get tuned up and better informed on these things, and that will be a big, big help. And you can work with them, and maybe I can help refine certain questions with my experience here. Okay, the next question is Joe Shep. Joe Shep. I have a severe sinus infection. The doctor said it can be sinus mycetoma, a fungal infection. He wants to do surgery. Do you know of an integrative ear, nose, and throat doctor? No, I don't, Joseph. I really don't. What do you recommend for me? Well, Argentin nasal spray is, in fact, antifungal. So I would be spraying up my nose. Here it is. Here's mine. I have my Argentin right here. My Argentin nasal spray, which is the silver nanoparticulates, so it's much more potent than colloidal silver. And first thing in the morning, I do that, and then I do it before I go to bed, especially in the fall, because it gets more dry, less humid, and I get more dried mucus, and inflammation can occur easier. And so that's an antifungal right there. Be on an extremely low carb diet. Never eat late, use systemic enzymes, take vitamin D, 15,000 international units a day, take a multi-mineral with zinc, and, just see how you do with that would be the approach. I would say um, he is not sure, and he did not test me for anything. He did an MRI and it shows a lot of congestion. Is there any test to find out what kind of fungal or infection I might have? Well, he can do a nasal wash or a sinus rinse and check it. But nothing will stay away if you don't eat a low carb diet, and your whole society is pimping you, tempting you to be just a little reactive puppet to a puff from a store like the donut store or the pizza store or the Kentucky Fried Chicken store, puffing out their fumes and making you think and salivate once you smell their triggering foods, and then you go like a zombie in there and you eat their high carb, high fructose corn syrup corrupting things. You have to overcome that, because any infection, any fungus, any bacteria, viruses, they love a person who is living in America, who is eating the standard horrific disease producing diet of processed junk, fast commercial foods. All right, so the next one is Cat. Cat says, my blood test showed high lead mercury over the charts. Would you recommend I do an EDTA chelation therapy there? Absolutely, it works. Okay, I've been doing this forever. There are doctors in the functional medicine with less experience, and they'll say mercury has to be treated with another medication because EDTA doesn't work for removing mercury. Poppycock, it does. It has always, and it always will. And it's the safest, most gentle way to not only pull down mercury, but all the other toxins. It is so safe, it's safe for toddlers, babies. So please use calcium disodium EDTA. Do it once a week. Do a challenge. That's the name of a test we do where we give you the EDTA chelation, and then we collect 6 hours of urine. And then after doing several, roughly approximately 30 chelations, we do the challenge again to see the lead, to see the mercury come down, the arsenic, the aluminum, all those things come down. Yes, yes, yes. She goes on to ask, I did clear out the mercury with a chelation that was 5 hours long, but now I have lots of lead showing. I'm trying to eliminate the sources as well. Yeah, do chelation. If someone told you that you cleared out the mercury with a 5-hour chelation, that's totally out of the typical standard teaching and training. I'm not God. I don't know everything. And if there's something new out there, but I know that unless you had a K, what is it? A K, what is it called? A K type bone density, and there's only 12 in the country or 11. Lead is in the bone, and you don't get it out with one 5-hour treatment for lead removal with EDTA chelation. Just not going to happen. So uh, you always have metal. You're breathing it in, you're eating it in. It's always a problem. So please see someone who is ACAM trained or someone like ourselves who have all these years of experience that can look at your scenario and do repeated, reproducible treatment assessments between a series of chelations to look at your progress. The next question would be, Julie, a 58-year-old male friend just got his blood work done. He's 6 foot tall, 170 pounds. His doctor is concerned about his cholesterol. His cholesterol is 203. Well, I think I would change my doctor then. Triglycerides 82. That's fantastic. HDL is 59. Call it 60. So when the triglycerides are about equal to the HDL exercise, you need to bring your triglycerides down a little bit. So there's room for him to cut back on his carbs some, but that's excellent. LDL 129. To me, if I had a patient like that, I would say, bravo, just cut a little more carbs back. Don't eat late. Do more weight training. Are these numbers concerning to you? No. And if so, what types of food can he eat, cut out to get the numbers to be more ideal? Just carb control. You're living in a carb pimping world that'll raise up the triglycerides, that will be associated with higher blood sugars, higher insulin, and all the diseases associated with chronic metabolic problems today. Cut the carbs, exercise more. God is so good. God is so simple. Megan, any recommendations for a middle-aged adult with an elevated Epstein-Barr virus IgG level? No symptoms of Epstein-Barr virus, but the IgG levels elevated for many months. Well, Megan, I would ask if you have kids and if they're in school, because Epstein-Barr virus is still on the planet, and your children and co-workers will all be passing around Epstein-Barr virus for time to eternity. And we who have already had this, we may have had mono, we might have had, bad sore throat, bad cold symptoms when we were younger. Now we have the history of Epstein-Barr virus, and IgG represents typically old uh, exposure, and you have a robust memory of it. I don't know how old you are, but if you get re-exposed to it, your body can quickly and immediately just reproduce and make the antibodies to defend you. So if you're not having symptoms, and if that's the only information I have, it sounds like it's nothing, and I wouldn't be worried about it. Typically, when your doctor does it, they'll do IgM, M like mother. Those are baby antibodies to Epstein-Barr virus, IgM, which indicate that there is an active new little infant kind of antibodies, brand new exposure. It implies that you have an active defense going on. Doesn't mean you're sick necessarily. You could be a little under the weather. But I suppose I have IgG to Epstein-Barr going up and down because I'm around people coughing, sneezing on me for 45 years already. I'm in my 70s and I never get sick. But I make sure I take my D, stay a low carb, exercise, drink my water, get a good night's sleep, wake up with the sunrise, ground my feet, take the D, the zinc, the Juice Plus, all these wonderful things, and so much more. But mostly I accredit it to my Bible reading and the peace I have. Because stress, if you're a worried person all the time, that cortisol is going to hurt your immune system. Veronica says, this will be the last question I can get in. What should ferritin levels be for a woman in her 30s? When do you recommend iron IV infusions? I like my ferritin levels in a woman to be around 70s, so that she's getting enough iron in her diet, digesting and absorbing it, to have healthy red blood cell formation in her body. If your ferritin levels are in, 5, 9, 15 levels, you probably might need that. But again, I don't like to jump to IV iron infusions. I like to look at your blood type, your digestion, a stool. I want to look at if you're taking digestive enzymes, systemic enzymes, where your sugars are at. Those kind of things all influence it, what your food allergies are. So if you have an inflamed gut, how can you absorb iron? And if we could get rid of the inflammation in your gut, like the calprotectin, the lysozyme, other things like that, the secretory IgA levels, then maybe you would not need a IV iron infusion. So with that, I am going to say we covered all the live ones, and if this is a blessing to you, please like, please subscribe, please share with a friend. We'll be here next Tuesday, 6 o'clock on the dot for 1 hour. I will mark all the questions I did, and then I'll pick up with next week on Tanya's question. So we'll go from there. So I got maybe 60% of the questions done today. All right. So the Lord bless and keep us all and love each other, walk in faith, hope, and love toward everyone in the next week until I see you. We need a little love, okay? And patience and forgiveness. All right. Good night.